We're talking about lumbar microdiscectomy. First of all, it's a bunch of big words, but lumbar means low back. Microdiscectomy means micro, which we tried to do a very small incision, often minimally invasive surgery. And then discectomy is to remove a broken part of the disc. And what we have is we have a spine model here, and it shows the various bones in the low back. And in between each bone is a disc. It's a shock absorber. And sometimes that disc will wear out, and will wear out with just some spurring and affect and pinch a nerve, causing back pain, butt pain, and leg pain. And that is sometimes called lumbar radiculopathy, but essentially it's mainly butt pain and leg pain because of a nerve on either side is pinched, and sometimes on both sides. But what we can do is, once we diagnose this with an MRI, we can often try to treat you with physical therapy and treat you without surgery. But for some patients, we'll need surgery, and a lumbar microdiscectomy is often chosen. And what that means is a patient will be put to sleep under general anesthesia, and to do a single one-sided microdiscectomy takes about 30 minutes to an hour to do generally. You put to sleep, as I've said, then we can make a small incision in your back and often use a little tube and put a little tube, which is minimally invasive surgery. They start out very small, and then we dilate to about the size of a quarter or less, so about an 1-inch incision. And then we're able to put this tube right on the bone here. And then we're able to spare the muscle, so that helps with, after surgery, feeling better and getting back to work sooner. Then we're able to ream this bone out, up and down, ream a little ligament out, and then I'm able to scooch or move over this nerve just a little bit to take care of the disc that would be broken, and then under a microscope remove that broken part of the disc. Then we make sure the nerve is completely free and not pinched by any other disc fragments. Then we wash your back out with clean, sterile water, and then we put numbing medicine in your back. We put a few stitches underneath the skin and the muscle to hold them together, and then some stitches underneath your skin, and put crazy glue on your back. So essentially all the sutures are underneath your skin. And then we often don't even need a dressing because the sterile crazy glue holds the wound together. And then we are able to let patients generally go within 2 to 4 hours after surgery. A few patients may stay overnight if they have other problems, such as heart disease or kidney disease or diabetes or things like that. But a lot of patients can go, and it can be an outpatient same-day surgery. There are risks with the surgery. The main risk would be probably numbness and tingling, and that's almost to be expected from surgery. The other risk would be foot drop or loss of your ability to move your foot, possibility of increasing your symptoms of back pain or leg pain, making your spine too weak, needing a further surgery, such as a surgery of screws and rods. That's generally about a 1 to 5% chance, so it's not very high. Infection or blood clot. So there are risks with any surgery that you're put to sleep, but there again, as a spine surgeon, I've done hundreds, if not thousands, of these procedures, and I would say 90% of people or more are very happy with the results. So it is a very effective surgery, and once again, we're doing the minimally invasive surgery, so most patients are quite happy. Going back to work, I would say minimum of 2 weeks off for a cool down period. I just want patients to just let their wound heal up, and then after that it may be a month or two before getting back to more rigorous tasks if your job responsibilities require that. But generally a couple weeks off from work for sure, regardless of your occupation.